New industry of psychotropic drugs like psilocybin, a mental health miracle or dangerous bad idea? The world of mental health has always been a complex one, with various treatments and therapies being used to support those struggling with mental illnesses. However, the emergence of psychotropic drugs like psilocybin has caused quite a stir in recent years. Some hail it as a miracle cure for depression and anxiety, while others warn of its potential dangers. In this blog post, we'll dive into the world of psychotropic drugs to explore their benefits, risks, legality, and future implications on mental health treatment. So buckle up and let's delve into this controversial topic. What are psychotropic drugs? Psychotropic drugs are substances that alter the way our brain functions, affecting our thoughts, moods, and behaviors. These drugs are used to treat various mental health disorders such as depression, anxiety, bipolar disorder, schizophrenia and many more. The most common types of psychotropic drugs include antidepressants, antipsychotics, anxiolytics, anti-anxiety medication, and mood stabilizers. Antidepressants are used to elevate mood by regulating serotonin levels in the brain. Antipsychotics help manage delusions or hallucinations associated with conditions like schizophrenia. Anxiolytics calm down individuals experiencing high levels of anxiety by reducing activity in certain parts of the brain. Mood stabilizers can help those living with bipolar disorder regulate their extreme shifts between manic highs and depressive lows. It's important to note that psychotropic medications should always be taken under medical supervision since they come with potential side effects such as weight gain or loss of sex drive. Nevertheless, when taken correctly, these drugs have been proven effective in treating mental illnesses for millions around the world, providing much-needed relief from symptoms which were once debilitating for sufferers everywhere. How do psychotropic drugs work? Psychotropic drugs, also known as psychoactive substances, work by altering the brain's chemistry. These drugs target specific neurotransmitters in the central nervous system that are responsible for regulating mood, perception and behavior. Some psychotropic drugs stimulate neurotransmitter release while others inhibit it. For example, selective serotonin reuptake inhibitors, SSRIs, increase levels of serotonin in the brain by blocking its reabsorption into neurons. Other types of psychotropic drugs like benzodiazepines enhance the action of gamma-aminobutyric acid, GABA, a neurotransmitter that helps to reduce anxiety and promote relaxation. Antipsychotic medications work by blocking dopamine receptors in order to decrease symptoms associated with psychosis such as delusions and hallucinations. Different psychotropic drugs have unique mechanisms of action, which is why they are prescribed based on individual patient needs and diagnoses. The effectiveness of these medications can vary depending on factors such as dosage, frequency and duration of use. What are the benefits of psychotropic drugs? Psychotropic drugs have been used for treating various mental health conditions. One of the significant benefits of psychotropic drugs is that they can help people suffering from depression, anxiety, bipolar disorder and PTSD to manage their symptoms effectively. These medications work by altering the chemicals in our brain responsible for mood regulation. Another benefit of these drugs is that they can improve one's cognitive function, including memory and attention span. This makes them useful in treating conditions such as ADHD and dementia. Moreover, some psychotropic drugs may act as an effective painkiller or muscle relaxant. In addition to this, certain types of psychotropic drugs like psilocybin have shown promising results in reducing symptoms of depression and anxiety among terminally ill patients. They are believed to offer a therapeutic experience that helps individuals confront their fears and anxieties related to death. It's worth noting that every individual responds differently to these medications. Thus, finding the right medication at the correct dosage requires careful consideration between patient and healthcare provider. Nonetheless, when used correctly according to medical advice provided by professionals experienced in handling them, psychotropic drugs can provide long-lasting relief from chronic mental illness symptoms, improving overall quality of life for those who need it most. What are the risks of psychotropic drugs? While psychotropic drugs have shown promise in treating certain mental health conditions, they also carry significant risks. One of the main risks associated with these drugs is their potential for abuse and addiction. Some psychotropic drugs, such as MDMA or ketamine, have a high risk of being misused by individuals seeking to experience their euphoric effects. Additionally, long-term use of some psychotropic drugs can lead to changes in brain chemistry that may result in addiction or other negative side effects. Another significant risk associated with psychotropic drug use is the potential for adverse reactions. These can range from mild symptoms like nausea or dizziness to more severe reactions like seizures or psychosis. Additionally, some people may be at greater risk for adverse reactions due to underlying medical conditions or interactions with other medications they are taking. It's important to consult with a healthcare professional before starting any new medication and carefully monitor any symptoms while taking psychotropic drugs. While there is promising research surrounding the use of psychotropic drugs in treating certain mental health conditions, it's important to weigh the potential benefits against the known risks before deciding whether this treatment approach is right for you. Are psychotropic drugs legal? The legal status of psychotropic drugs varies from country to country. While some countries have strict laws against the use and possession of these substances, others allow their use under certain conditions. In the United States, for example, psilocybin, a type of psychedelic drug found in mushrooms, is classified as a Schedule I substance. This means that it has no accepted medical value and a high potential for abuse. However, some states such as Oregon have recently legalized its therapeutic use through licensed facilities. Similarly, MDMA, also known as ecstasy, is also classified as a Schedule I substance in the U.S. but has been granted breakthrough therapy status by the FDA for treating PTSD. Other countries like Brazil and Jamaica allow ayahuasca ceremonies which involve drinking a tea made from plants containing DMT, another type of psychedelic substance. While many psychotropic drugs are currently illegal or restricted in most parts of the world, there is growing interest among researchers and policymakers about their potential therapeutic benefits. As more studies are conducted on these substances' effects on mental health disorders like depression and anxiety, it may lead to changes in their legal status over time. What is the future of psychotropic drugs? The future of psychotropic drugs is a topic of much debate and speculation. Some argue that these drugs have the potential to revolutionize mental health treatment, while others warn of the risks and dangers associated with their use. One possible future for psychotropic drugs involves continued research into their effectiveness and safety. As more studies are conducted, we may gain a better understanding of how these drugs work and who they can benefit. Another potential avenue for the future of psychotropic drugs is increased regulation by government agencies. This would help ensure that these powerful substances are used safely and responsibly, minimizing any negative side effects or risks. Advancements in technology could also play a role in shaping the future of psychotropic drugs. For example, new methods for synthesizing these compounds could make them more accessible to researchers and clinicians alike. Ultimately, only time will tell what lies ahead for this emerging field. However, one thing is clear. As our understanding of mental health continues to evolve, so too will our approach to treating it, including through the use of psychotropic medications. Conclusion. In today's world, mental health is a major concern for many individuals. As we have seen, psychotropic drugs like psilocybin are gaining popularity as a potential solution. These drugs have the ability to alter one's perception and allow for new forms of thinking that may help improve mental health. However, it is important to remember that there are also risks associated with these drugs, such as triggering psychosis or other harmful side effects. There is still much research needed to fully understand the implications of using such drugs. As we move forward, it will be critical to balance the benefits and risks of psychotropic drug use in order to ensure safe and effective treatment options for individuals struggling with mental illness. Ultimately, while these drugs do hold promise as a potential cure for various mental illnesses, they must be approached cautiously and responsibly by medical professionals and patients alike. Only time will tell what the future holds for this emerging industry of psychotropic drugs.